Respected chairpersons, and the members of the dais and delegates present here, it gives me great pleasure to start the medical legal session with a basic topic of consent. Consent, you know, from beginning we know that patient has a fundamental and legal and ethical right to determine what happens to their own bodies. So health professional must ensure the patients know enough to enable them to decide about their treatment. So obtaining consent for major or surgical procedures is not new. It is an essential part of daily medical practice. It is a part of quality health care. So failure to obtain consent occurs due to the doctors think that one procedure, example cataract, is too routine or too trivial, so that a complete informed consent is not necessary, because we're doing a number of cases doctors are too busy to take the consent. So if you don't obtain the proper consent, patient may complain that you did not inform me of the risks which became a reality, or he may tell I would not have consented to the operation if I had known of the risks. So you have caused my injury and you have failed in your duty to convey the correct message. It amounts to negligence. So sufficient information should be given before taking the consent of the patient for any surgical or for the investigative procedures. Information particular to the patient, it may be verbal and plus documented in medical records about the patient medical condition, what happens if not treated, about uncertainties in the doctor's diagnosis, options available including non-treatment and other known concerns. So verbal consent is in medical legal actions will always be challenged. So everything has to be written down. As there is no ideal consent form in the world, it is always best to document everything relevant to the particular case. It protects everybody, your patients, colleagues, and most importantly ourselves. So informed consent isn't about us signing a form. It is about having a relationship, having an open, engaging, and respectful discussion. Questions are encouraged. What other questions do you have like that you have to ask the patient, rather than discourage, like do you have any other questions like that? So minimum requirements for informed consent are well defined. Patients should receive information regarding the nature of the procedure, including whether it is a diagnostic or therapeutic procedure, benefits of the procedure, alternatives to the procedure, along with their risks and benefits, risks involved, especially those that are severe and likely to occur. For example, for a cataract, we should explain all the nature of the procedure, explain along what is cataract and what is being done, and what are the benefits. You know, it is a restoring vision, and there are alternatives, different types of IOLs, and without surgery, what will happen, all those things, and what are the risks involved. That is, complications can occur with any type of with any surgeons. So there may be drop in vision or hemorrhage, or reaction or dislocation of the lens or infection. Any of all the complications should be explained, but we should not threaten the patient that these are major complications, but we should tell the patient in all these things. So too little information, the consent is not valid. So poor handled informed consent can lead to complaint, medical legal litigation, or discipline for negligence. Consent is not mere a patient signature on a consent form. A valid consent that requires the patient to be competent, patient has sufficient information and understanding, patient consents voluntarily, that is free from coercion, fear, or deceit. So practical tips are, remember, successful relationship between the doctor and the patient depends on trust. So effective communication is the key to enabling the patients to make informed consent or decision about the treatment. Providing sufficient information to patient and respond to questions honestly. Don't withhold any information necessary for the patients to make the decision. And if the difficult cases, you can refer it to the other doctors. So who should obtain a consent? Normally, it is a doctor undertaking the medical intervention is primarily responsible for obtaining the consent. He may delegate the task to the junior, who is competent in obtaining the consent or has sufficient knowledge of the proposed procedure and risks involved. So One more question is how long the consent is valid for. The court has not laid down any specific time limit. Advisable to review the consent prior to the procedure if considerable time has elapsed, material changes in the patient's condition has occurred, or there is changes in the procedure, nature, purpose and risks. New treatment options have become available. There are consent forms are available for operation, procedure and treatment for mentally competent adults, minors or mentally incompetent patients with legal guardians. Consent for minor procedures or operations and treatment. Forms for patients who are unable to consent for operation, procedure, treatment, like patients who are unconscious or patients who is mentally incapable of giving the consent without the guardian. To summarize, comprises explanation in person and where applicable with the help of consent forms and fact sheets. Information particular to the procedure, nature and brief description of the procedure, common risks and complications, uncommon risks and complications, what to expect before and after the procedure. Information particular to the patient's medical condition, what happens if not treated, uncertainties in the doctor's diagnosis, options available including non-treatment, additional procedures like anesthesia and blood transfusion if it is required, as we explained. This is a common checklist: the name of the operation, nature of the proposed treatment, what the operation involves, other treatment options or alternatives, potential complications, risks of the operation, risks of non-treatment. And special precautions required post-operatively is to be explained, benefits of the treatment, and what are the limitations of the treatment, success rate of the operation, what happens on admission, and how the patient will feel after the treatment. All this should be explained. Some procedures, specific consent is required, like neoplasia, capsulotomy and others. The detailed description of the procedure has to be done. General risks of surgery, specific risks of this procedure, reference to anesthesia and blood risks like that. Special procedures like capsulotomy, phakic IOL or LASIK procedures, refractive surgeries, fundus angiography, diabetic retinopathy, vitreoretinal surgeries, ROPs, DCR. All these surgeries, specific consent has to be taken other than general consent. In some conditions, consent is not required, like in medical legal cases brought by the police. Consent is implied under section 53 of the Criminal Procedure Code, hence can be examined. Consent is not required in medical examination and issue of certificate for insurance purposes, insurance policies. Cases where it is issued in the interest of the community or a person suffering from disease under notified category, to notify the authorities only, and prisoners. And the other one is examination under court order or request with the police officer under the Criminal Procedure section 53.1. So all these consent forms are available in our AIOS website at www.aios.org, or it can be downloaded from any of the websites of American or Australian Academy of Ophthalmology.